let's talk about hand expression. If you're breastfeeding, about to deliver, or even considering breastfeeding for the future, hi, I'm Gabby. I have worked as a postpartum nurse for the last 11 years on the mother-baby unit, and the last 2 years I've been working as a lactation consultant. Let me show you the proper way of how to hand express your colostrum. Now, when you are doing hand expression, you want to put your fingers on the outer edges of that areola. Everybody's areola is going to be a different size, so it's not going to look like this. But essentially, your fingers should go about on the outer edges of that areola. You are going to push back against your chest wall, compress, let it go. Push back against your chest wall, compress, and let it go. A lot of the times I see patients kind of just pinching at the nipple, or they're just squeezing the breast, or sometimes even just pulling at that breast tissue instead of pushing back. You don't want to do that. What you want to do, again, is push back against that chest wall, compress, let it go. And you can move your fingers around to really get that milk going, okay? You don't have to stay in one spot. And you can do this for a couple of minutes or so. It might take a minute or two for that milk to start flowing and noticing a little glistening at the nipple, or even a couple little droplets come out. If you are unsuccessful and you can't express your own breast milk, that's okay. It doesn't mean you don't have breast milk. You have that early milk, which is called colostrum, and again, it takes some time for it to come out of that breast to really get worked down, because it's that thick honey-like consistency. So keep practicing and you'll eventually get it. It takes some time, honestly it does. When I first started hand expressing at working on the unit, I wasn't great at it. It takes some time to get adjusted to it. Now, hand expression is going to be a great thing to do when you are having difficulty latching your baby. If you and your baby are being separated and you don't have access to a pump, the sooner you can get stimulation to that breast, the better for your milk production. So don't be afraid to do hand expression while you're in the hospital. And you can ask the staff for a little medicine cup or even like a teaspoon to start to express some of that colostrum. You can also do hand expression prenatally as well, around 36 or 37 weeks. However, only if your doctor says that it is okay and safe for you to do so. Collecting your colostrum prenatally is also beneficial because, again, if you are having issues latching your baby, again, if you are separated from your baby as well, you already have that colostrum collected, so you can bring it from the house and we can use it in the hospital. If you have your colostrum frozen, it has to be used within 24 hours once it's been thawed. If you're unsure if you should be collecting colostrum prenatally before delivery, feel free to talk to your doctor about that.